When you've got multiple injuries, you can't treat them all at once. If you try, you'll stall. In the next 3 minutes, I'll show you how we prioritize SIMS in complex hands, what to treat first, when to pause, and why the hood matters. SIMS minimizes the need for more techniques, and it's about sequence. We restore a normal movement pattern first, then layer complexity. These are the results my student Carl achieved through online training and mentorship. His 34-year-old patient had a motorcycle accident. He had an ORIF of the radius and ulnar, wrist spanning plate, joint capsulotomies, intrinsic muscle releases, tenolysis, nerve transfer, and swan neck deformities were resulting in the overactive FDP with minimal opportunity for FDS function. After multiple capsulotomies and intrinsic releases, you'll see an aberrant initiation if the brain chooses the loosest joints. So our rule is to block the loosest joints and drive motion to the stiffest joints. We rehearse DIP, PIP, MCP joint motion and sequencing in a SIMS cast. Then, when the pattern normalizes, we chase secondary deficits. In this case, we blocked DIP joint motion to achieve differential glide of the FDS and FDP. Many therapists ask me, should they apply a hood or not? In complex cases, the dorsal hood often makes the difference. It gives proprioceptive feedback and it reduces chaos. Thickness matters. If it's too thin, it breaks. And an infection halts the use of SIMS. That's not failure, it's an opportunity for triage. So Carl made a hybrid cast to protect his gains. He didn't progress with the hybrid cast, but he also didn't lose what he'd earned. And that's a win during a setback. During this time, he also used Allison's wedges for spacing and proprioceptive input. Complex systems need time under correct constraint. As wear time accumulated, the pattern improved, and then we progressed the design to address the remaining MCP joint stiffness. So the mantra is constrain, normalize, progress.
Okay, he's going to try to pull away from this cast. So we have a little bit of pre-bend in the dorsal hood just because I want to kind of try to help those lateral bands get in the right position. He's also going to work on, he's been working on kind of getting these DIPs passively extended, but he's also working on getting them active.
Firstly, movement pattern matters most. And secondly, you cannot treat everything at once. You need to prioritize. Delay isn't denial. Just return to the technique as soon as possible. The hood matters. It's proprioceptive coaching. If you want to learn more skills, then comment order and I will DM you the November 6th training. It's live. There's no upsell, just the Zoom link and reminders. I hope to see you there. Invite your colleagues and let's learn some more.